My name is Taylor Cook. I'm a student physical therapist and a certified strength and conditioning specialist. Today we're going to be talking about repetitive strain injuries, which I'll refer to as RSIs, and the rehabilitation of those injuries. So, for the overview, first we're going to go over the characteristics of an RSI, the diagnosis process, rehabilitation, and the importance of treating these injuries at an early stage. So, if everyone could break down into groups of 5 and write 3 things you know about RSIs. Good. Now come up and write one of those things on the board. No repetitions. Now we're going to go over the characteristics of an RSI. They start off with weak and tight muscles, which lead to stress in the soft tissue structures. This causes increased tension and friction within the muscle and the joints, causing tendinosis or problems with muscle length, and can also lead to decreased circulation and swelling. Now, an important thing to remember, green means go. In these 3 areas, that's where you can provide intervention. If it's down in one of these areas, where there's increased production of scar tissue or buildup of adhesions, you should refer them to another practitioner, such as a physical therapist, which I will discuss later in the presentation. Good. The characteristics of a repetitive strain injury. It is an umbrella term, which means that it refers to a group of injuries rather than one specific cause. It can also be referred to as cumulative trauma disorder, repetitive motion injury, occupational overuse syndrome, and work-related musculoskeletal disorder. There are multiple causes, but they are primarily muscular issues, leading to weak or shortened muscles with repetitive motion, reduced circulation, which increases swelling, and elastic deformation due to a repetitive cycle completing the same motion all the time. There are several risk factors for developing an RSI. They include poor posture, repetitive movement, lack of rest, lack of strength, and sustained force over a period of time. And the location of repetitive strain injuries is in the upper extremity primarily, because those are the motions that most people do on a daily basis over and over again. Athletes are also at risk for repetitive strain injuries, but they're more likely to develop them. Tennis elbow, IT band syndrome, things of that nature. So, who's affected by repetitive strain injury? We just talked about this a little bit, but factory workers, typists, computer operators, musicians, athletes, or anyone who does repetitive motion frequently. So let's think about what we've talked about. Can one person come up and draw a part of the RSI cycle on the board? That was the first slide with the green means go for intervention. Good. Now this is the cycle. It's very important to know when we can treat. Now, can someone else answer what the risk factors for an RSI are? Perfect. Now let's think ahead to what are the symptoms of RSIs. So we're going to move on to the diagnosis process with the symptoms. There's no exact diagnosis. People have chronic symptoms, but there may not be evidence of injury. There are specific and non-specific symptoms. Specific RSIs experience pain, tenderness, swelling, tingling or numbness, and carpal tunnel. But the non-specific injuries have no specific symptoms. They could be varied. They could just consist of chronic pain, and it's very frustrating for them because it's hard to receive a diagnosis. Again, the phases of rehabilitation. There's inflammation stage, where they need rest from activity. There's the repair stage, where they need to increase flexibility and work on submaximal exercise. And then there's the remodeling stage, where they need to work on specific exercises to improve their function at the job. Rehabilitation. There's no good evidence on the specific treatment of RSIs. So unfortunately, we're going to have to do an individualized approach, which, I mean, that's not unfortunate, it's just there's no set protocol of treatment. And we're going to have to focus on conservative methods because that's within our scope of practice as personal trainers. I like to focus on 3 areas: flexibility, posture, and exercise. Now we're going to go into the overview of flexibility, posture, and exercise.